and how can communities protect themselves and their loved ones without panic or misinformation. So Ebola virus is a dangerous viral disease, but awareness and early action and proper prevention measures can help save lives and also reduce its spread. And to guide us through this important discussion, we are joined by a professional who is going to help us understand what exactly is Ebola, clearly from the symptoms and to the transmission, to the prevention, treatment, and also the public safety at large. And this is none other than Dr. Senkungu Nassif Hussein. You're most welcome, Doctor.
Thank you very much. I'm very happy to be here.
Yeah, thank you for coming.
You're welcome.
So how has been your journey coming here? The week is ending.
Yeah, the week is ending. It has been stressful. We have to run over here, there, SOPs and other things. Remember, we are in an outbreak, so it has not been very easy, but good enough.
You're here.
Thanks God we have finished this week so safely.
Okay. Yeah, thank you very much, Doctor. So as our dear viewers we had said that this is a very important discussion, and of course TV1, we are here to serve you and make you informed. This information is going to help your household and tell you exactly what you need to hear. So Doctor,
yes.
To begin with, let's exactly start with what is Ebola? Because we are hearing people, Ebola. What exactly is Ebola?
Ebola is a disease. Actually, it is a viral hemorrhagic fever.
Okay. So
by only that statement, someone has to understand that it is a viral disease caused by virus.
What is hemorrhagic? Exactly that.
Like, that is what I'm trying to explain. So it is a viral hemorrhagic fever. So it means it is caused by virus, a viral disease, like viruses like COVID-19 viruses, but this one is called Ebola virus.
Okay.
So Ebola virus comes from a family of big, it is a very big family of viruses called the filoviruses, but here specifically we talk about the Ebola virus.
Okay.
So it has very many strains. It has the Zaire strain, it has the Sudan strain.
Nowadays we are hearing the Bundibujo strain.
We are now having the Bundibujo strain.
Okay.
It is now the one affecting people, and it is the one causing this outbreak we are having now. So that is the virus.
Okay.
Then it is called a hemorrhagic fever.
Okay.
That one means hemorrhage means losing blood.
Okay.
So meaning someone will lose blood at one point when they have Ebola.
Okay.
And fever. They will have a very high fever, and it is one of the signs and symptoms, as we shall see there in time to come.
Okay.
Yeah.
So what exactly causes this Ebola virus disease?
So we have the cause and the mechanism of infection.
Okay.
So the cause is that virus we've talked about, the Ebola virus disease. Then how it is caused, how someone picks it up. So it is two-way.
Okay.
Remember, Ebola originated from animals. It is originally an animal disease. So animals that were linked to Ebola include the gorillas, chimpanzees, antelopes, monkeys, and even the fruit bats, which are considered the original reservoirs of this virus. Yes. So now when someone eats flesh or eats meat of these animals that are infected, wild animals that are infected, they will be able to pick up this disease.
Okay.
That is the first cause or first way someone picks up this disease. Now the second way, it is picked up through contact with someone who is already infected. That one is not animal to human, but now human to human.
To human, yeah, sure.
Yes. So there are several ways you can pick up this disease from someone, and the first way is through contact with fluids of an infected person. And the fluids we talk about, we have blood, we have saliva, we have urine, we have stool, we have even semen, we have vomits, we have sweats,
Yes.
anything concerning fluids of someone. They can, if you get into contact with them and they are infected,
Of
there are
course,
very
you're
many
going to
chances of
get
you picking
that.
up this disease.
Okay. So,
Yeah.
doctor, you've talked about this disease originating from animals and the people eating fresh or from animals. We have that Bundibujo strain that is right now making a lot of noise outside there. So, how do you think that one started? We're just eager to know. Because it's Bundibujo, and in Uganda we have Bundibujo, and they say it originated from there.
Yeah, most of the times diseases are named according to where they have originated from, or
Okay.
where the first person has been found, or the place. For example, we have another hemorrhagic fever.
Okay.
It is called Marburg.
Yeah, Schumabug.
Yeah. So Marburg was named according to some city in Germany.
Okay.
That is where the research was done, and that is where the person was found.
Yeah.
But they had a contact from Africa.
Oh, okay.
So those are the ways someone can name a disease. They can be named according to maybe someone that has discovered it, maybe the place that they have discovered it from, maybe the place, anything.
Okay.
So that is how they named it Bundibujo virus or
Okay.
Bundibujo strain. Yeah. But the origin of the disease, it was first seen in 1976
Okay.
here in Uganda. No, it was first seen in 1976 in Congo.
Okay. Not here
Yes.
in Uganda.
Yes.
Okay.
In Congo,
Yeah.
DRC, and there is a river called Ebola.
Oh, okay.
Yes, there is a river called Ebola. So someone there maybe ate some animal that was infected with this disease, and that is how we got the first contact.
Okay.
Someone was coming from there, and
Then
that is how they discovered
the virus, the
Yes.
disease to
Yes.
that person.
Yes, but here in Uganda, we've had several outbreaks of the Ebola disease.
Yeah, of course.
And the
Many.
most serious one was in 2007.
Yes.
Yeah, in 2007, actually, it was that Zaire strain itself.
Yeah.
It was very, very fatal, and many people died.
Of course.
And another one was in 2022, 2023, that one was Sudan strain.
Okay.
Yeah, even last year we had, but it wasn't so concerning. It wasn't a public health.
Is
threat.
it the first time Uganda as a country we are getting to experience this Bundibujo strain?
Yeah, basically. On the 15th of May,
Yeah.
this very month, that is when this we got to see this one Bundibujo strain
Okay.
of a contact, a person that had traveled from DR Congo, and yeah, currently we had 9 cases, but like 1 hour ago
They
there
have
was-
confirmed
there was an
more.
update of 2 patients,
Okay.
and
Yes.
they are all travelers from Congo.
Coming in here.
Yes.
Okay. So, doctor, why is this Ebola virus disease said or considered to be so dangerous?
Now, Ebola virus disease is said to be is said to be very dangerous because of the way it manifests,
Okay.
the way it affects someone, and the time it takes to do that.
Yeah.
For example, someone can have a disease and they live with it for very long. But Ebola disease, we can get to see signs for as early as 1 to 2 days.
Okay, so it comes, the signs and the symptoms come very fast.
Yes, very fast.
Okay.
So we have early symptoms and then we have late symptoms.
Okay.
So that is one of the reasons as to why it is dangerous. Secondly, contamination rate.
Okay.
The way it spreads and the way people can be contaminated, it is very, very fast.
Okay.
Yeah, that is why it is a very serious public health demand. In that, even one case like this, the government declares it as an
outbreak.
Yes.
Because we in Uganda we had not yet received more than one case, and then WHO said this is a disease that is causing that needs international concern.
Yes.
So that's what you mean by that.
In public health, there are some diseases which even one case or even contacts can make the authorities declare as a public health whatever
Okay.
Conflict. If, for example, these hemorrhagic fevers, even one contact like this or one patient like this, they make it a public
very
health
big
threat.
Yes, sure. Okay, so doctor, what makes this outbreak spread like very quickly in some communities?
Now, here in Africa, we live a very social life.
Of course.
We live in a life of being together, and people do not adhere to basic standard operating procedures of safety, like safety procedures. People do not wash hands.
Yeah.
People are always shaking hands. People are always in chiwozi, like very closely. People share things. People share clothes.
Yeah.
People share a lot of things. You might find that even if someone dies here in Uganda, like even the rituals they do, even the things they do during burial, like they create very high contact.
Yes, sure.
So here, even if one person like this gets infected, the way they move, the way they live, and the way they handle their lives can even spread in a whole community in even one day.
Okay.
Yes. So that one makes it very dangerous.
Very difficult to even maintain the virus.
Yes.
Okay, so doctor, let's get into the symptoms and signs. What are the early symptoms that can manifest after someone getting into contact with an Ebola-infected person? Let's start from there.
Now, when someone gets into contact with an infected person with Ebola virus disease, they get early symptoms as early as 1 to 2 days, 2-3 days.
Okay.
So you get to see things like abdominal pain, fever, which is sudden, like sudden onset of fever.
Yeah.
Someone gets to have a headache, abdominal pain, muscle pain, joint pain. Someone feels very tired. So those are some of the early symptoms someone can get. But we also have late symptoms.
Okay.
Or we call them severe symptoms.
Okay, that's when the case has become like so high.
First the fever is too high.
Okay.
Very high temperatures. Red eyes.
Oh, okay.
Eyes can be very, very red. Someone can get what we call internal and external bleeding.
Okay.
So in internal bleeding, you find that some of the internal organs have ruptured, and all blood vessels internally have ruptured.
Okay.
And then they start bleeding internally.
Yeah. What causes like that rupture of the vessels inside?
It comes from the mechanism of injury of this virus.
Okay.
How it affects the blood vessels. How it's actually we call it this virus causes what we call organ failure.
Okay.
So it affects all those internal organs and they go on maybe misbehaving. That's like how a layman can call it. And you find spontaneous bleeding of blood vessels inside.
Yeah, sure.
Even that one that I told you of very red eyes, you find that the small blood vessels of the eyes have ruptured.
Okay.
Yes. So you find rupturing of blood vessels. In external bleeding, someone gets bleeding from almost all external openings.
Oh, okay.
The mouth, the nose, the ears, all openings of the body can bleed.
Okay.
The gums, those are some of the late symptoms and they are very hard to manage.
Oh my God.
And the very last one is organ failure.
Okay.
And it is what causes death in Ebola patients. You find that the whole organ systems have died.
Yeah.
And that is the end.
Okay.
But if managed early, we cannot reach that level.
Okay. Doctor, why can Ebola sometimes be confused for other illnesses and like a fever, malaria in the beginning?
Because they share symptoms, of course.
Okay.
For example, in our country here, we have this country is endemic of malaria, if you know that.
Yeah, sure.
So we have very high malaria. Actually, malaria is the leading cause of death in this country.
In Uganda.
Yes. And it manifests first through fever, general body weakness, headache, abdominal pain, and these are shared symptoms with Ebola.
Okay.
So it is very easy for someone to
get into contact.
Yes, that is why even in this time, we advise people that even if you get
a small fever, you have to go for a checkup.
Do not self-medicate.
Okay.
Because you might think it is malaria, but you're creating more contacts with people. And,
spreading the disease unknowingly.
Yes. So that question can be answered by shared signs and symptoms with these diseases.
So, doctor, many people panic when they hear about Ebola. How can communities stay alert without creating fear for this virus?
Now, that one can be managed by adhering to public health measures.
Okay.
There are things that can be done in public health which help those people. For example, when you suspect to have Ebola, what do?
Go to a hospital.
If it is me that you suspect to have Ebola, what do? You
communicate.
Now, some of the things are one. First, when you suspect yourself to have Ebola, isolate yourself.
Okay, yes. Self-isolation.
Yes, self-isolate. Now, there is this thing of running to a health facility.
Okay.
If maybe you want to go to a health facility, by the time you reach there, chances are very high that you will have contacted very many people. But someone who has isolated themselves at home and tells someone to go and call authorities or go to a nearby health facility to tell them that maybe you have someone that you suspect to have Ebola, they will also come prepared.
Yeah.
Remember, if our health workers are not well prepared, they will also be part of the contacts. And even currently, as I say, the highest number of contacts we are having, they isolated actually are health workers.
Yeah.
So isolate yourself, tell someone to go to a facility, call these people, tell them we suspect someone there and there to have Ebola. That is one.
Okay.
Number two, do not self-medicate.
That's an issue we are currently facing as a country, people self-medicating, so it's something they need to learn.
Because when you suspect malaria, because of having a fever or what, you will go maybe to a drug shop or pharmacy, buy some Panadol. People have a tendency of getting concoctions, people like the way they did in COVID. You find someone steaming, you find someone doing this and this. So within one day of doing that, you will find that you have contacted very many people and it has become now more dangerous. So that is one, do not self-medicate. Then the first one we said was isolate yourself.
Yes.
Then us, as the rest of the people, what we should do is we do not create stigma in these people.
Yeah.
Like we do not stigmatize these people, because Ebola can be healed and can go.
Okay.
Yes, forever it can go. Maybe something our people should know is that people that have healed from Ebola can keep the disease in their body for some little days.
So it doesn't heal like immediately. It takes time.
Yes. So still those people, we do not be into contact with them, because they can keep the virus for some few days and then it disappears. So we advise people not to create stigma, not to stigmatize these people that have been affected by Ebola.
Okay. So doctor, how dangerous is misinformation during this outbreak? Now,
misinformation, first of all, misinformation is when we spread information that is not true.
Okay.
Or for example, someone says Ebola does not exist. Then someone can say it can also be doubtful information.
Okay.
Someone says, but this one is saying this, but it is he looks as if he's not sure.
Yeah.
So First of all, this one will make people reluctant to to obey to standard operating procedures. And if you do that, then the spread will be higher.
Okay.
So misinformation is very dangerous, especially in this period, and to a disease like Ebola virus disease.
Yeah. Okay, so doctor, also can traditional burial practices contribute to the spread of Ebola?
Now, we have 3 ways of Ebola spread. The first one we talked about of getting it from animals.
Then body
then secondly,
fluids.
body fluids. Then thirdly, the body themselves.
Okay.
The bodies themselves, direct contact with the bodies. Now, these bodies can be live bodies. For example, like people that share same beds. And you get into contact with that person. Yes.
Yeah.
Then dead people.
Oh, okay.
So dead people. In this time, when someone dies of Ebola, or you suspect someone to have died from Ebola, there is a team. We have a task force in this country that was put to fight Ebola. So that task force has also a burial team.
Okay.
So in this time, you cannot just bury an Ebola patient like that. The body can be handled by these people, and they have ways of doing this to reduce on the way it is spread to other people that are still alive.
Okay. So also, doctor, you talked about surviving. Someone can survive Ebola. How is the diagnosis and treatment for Ebola?
Now, this Ebola that we are having now is the Bundibugyo virus, or the Bundibugyo strain.
Yeah.
The Bundibugyo strain, why it has raised a very high concern, and why you're seeing those it is on high alert even at WHO level.
Yes.
Is because it has no vaccine. That is one.
Okay.
Number 2, its mortality rate
is high.
Over 30 to 50% of patients can die if not managed well.
Properly.
Yes. The management, it has no distinctive management, like this is what we follow to manage. So we do supportive management.
Okay.
The health workers know how to manage such patients.
Yeah.
Yes.
Okay. Also, doctor, what is the best way people can prevent themselves from Ebola transmission? And how important are these procedures we are seeing government is putting up? Hand washing. Yeah.
Now, the best ways to prevent spread of Ebola is we have to obey or we have to move by or live by the standard operating procedures.
Okay.
And these standard operating procedures include washing hands very well.
Yeah.
If you wash hands more often in a day.
You mean that strain can be killed just by using soap?
Yes, use soap. We use water and soap.
Okay.
It can be erased from your palms, just in case you've shaken hands with someone.
Even getting into contact with someone's body fluid. Let me say, when they just pass by you can use soap, and the strain is no longer there.
Yes, you can wash. You can wash hands with soap. You can use sanitizers, those alcohol-based sanitizers.
Yeah.
Yes. Then another thing, we don't advise people, or we advise people to cook meat well. Okay. Because anything that can come from animals is very dangerous. Okay. So you cook meat well to kill the virus just in case it is there. Then there was also an issue of masks. Someone says do not wear masks. Then the other ones are saying wear masks.
Yes, because you said bodily fluids, and we may remember when someone is talking, the saliva is coming out of the mouth.
Yes, exactly. So some people are saying, since it is not an airborne disease like COVID-19, it was spread of air. Okay. So it can be spread. So if you put a face mask, it can protect you. And here, since it is not airborne, maybe there are reduced risks of spreading through air. Okay. But remember, when speaking, some people can speak as they are spitting. Yeah. So meaning if you put the mask, it can also help at some point.
Sometime and prevent you from getting the disease
but it
at
is
some
not
point.
a basic prevention measure.
Okay, so also, Doctor, as we are winding up with our questions, what role does the community cooperation play during these outbreaks?
The community is fighting the spread of wrong information.
Okay.
That is one, because when you spread wrong information, you are spreading the disease more.
More, yeah.
Yes. If you reduce on the spread of wrong information and maybe listen to what is coming from the ministry and the task force, those are the people that are supposed to give us what we are supposed to follow and what is real happening on ground and what is happening regarding Ebola.
Okay.
That is one. Then the public can also obey or adhere to the standard operating procedures.
Yes.
As we've talked about them. Wash hands so oftenly with soap. Do not go into contact with people anyhowly.
Okay.
Do not share clothes. Do not be into contact with people, even if it is kissing in this time.
Okay, so that's something Ugandans need to understand more and more, because Anyways, let's continue, Doctor. Is there any available treatment for Ebola and vaccine?
Yes, for some strains it's there, but the current strain, the Bundibugyo virus, the Bundibugyo Ebola virus has no vaccine and it has no treatment.
Okay.
Yeah, but we have ways of managing it in hospital and someone can heal.
Okay.
Yes.
So, Doctor, also, how important is supportive care in the recovery from Ebola, and what determines the survival chances of Ebola patients?
Basically, for a dangerous disease like this that has no specific medicine they use on it, has no vaccine, meaning we go to supportive medication.
Okay.
We go to supportive treatment. Now, for anything that we use on supportive medicine or supportive treatment, early diagnosis is always what will determine our prognosis.
Okay.
It is what will determine your recovery. So meaning, in case you come early, you live early and you live very happy and you can heal. But since we talked about the mortality rate for this virus is around 30 to 50%. So meaning, the later you come, the chances are low of you surviving. But if you feel you have a weird sudden onset of fever and you go to hospital early, chances are very high that you're going to go back home well.
Okay. Also, why does Uganda remain alert whenever there is an outbreak in the neighboring country or in the country itself?
Now.
And what measures has it put to combat this whole disease? Now,
first of all, our system has been very efficient in managing of outbreaks all along, over time.
Yeah.
Even if when you look at COVID-19, we had the best management in the region.
Okay.
Yes, and we had the least mortality rate. Very many people died in other countries, but here,
for us, we were safe.
Yes. Now, what you're saying, what the government is doing.
Yeah, right now.
And why the government is alert is because we have very many active borders. And we have very many busy border districts like Kasese, those Bundibujos. We have very many busy border districts, as you know them. We have Elegu here in Sudan. We have here Malaba, something like that here. So we have very many active border districts. So if you have an emergency that includes people traveling from another country to your country, it means you have to be very highly alert. Yes.
Okay. So how also important is border screening and surveillance as a country? And also, what should travelers and border communities especially be aware of today as they're coming to Uganda?
Border screening, first border screening is important, because by screening at the border, we shall not let in infected people.
Okay.
Yes, because when you find, even the cases they have discovered today, or they have screened today, are Congolese nationals.
Coming in Uganda.
Yes, coming in Uganda. So if the screening was very serious at the border in the first place, we couldn't have even the patients we are having.
So there are some weaknesses.
Yes, okay. There were some weaknesses, but I think by now the task force is very reinforced.
Okay.
Yeah.
Also, we also asked about what the travelers and people coming in be aware of.
Currently, I think we have no travelers coming from DR Congo. Yes, that border was closed.
Okay.
So we have no travelers from that side. And our travelers have also faced a challenge in some countries because of this outbreak.
Yeah, we've seen, I remember we do news.
Some countries are
like
stopping
Bangkok, China,
yes.
Canada, yeah. They've put up restrictions.
So I think it is very dangerous in that way. But me, I'm very sure our task force is managing it well. Okay,
so people should be calm and vigilant.
Yes, just obey standard operating procedures and make sure you have maybe somewhere you get the knowledge from, like TV1, things like that. So get good or authentic news sources.
Yeah. Yes. Okay, thank you very much, Doctor. So as we are winding up, what's your last take on Ebola, and what message would you like Ugandans today to know about Ebola as we are winding up?
As we're winding up, I want to assure Ugandans, or tell Ugandans, or inform Ugandans that Ebola is treatable. That is one. If you come early to hospital. Okay. And then you have also some risk groups, high risk groups, like pregnant mothers. Yeah. Because when a pregnant mother gets infected and they do not come early to hospital, they can die and their child can also die. Okay. So that is very dangerous. So Ebola can be treated if you come early to hospital, and we also recommend people to adhere to standard operating procedures. Okay. Yes.
Okay, thank you very much, Doctor. So as we are winding up, people would like to know if at all they have questions and they want to reach out to you for more advice on this and maybe some other conditions, if you could leave for them your number and also send greetings to one or two people that are watching you today.
My number, maybe I can read out for them, is 07 66 98 13 75. Okay. But I'm very active on social media, on TikTok, Dr. Nassif Hussein, on X, Dr. Nassif Hussein, you will see, and there's also some educative content that you will also see, medical content. You can always reach out on these pages and maybe we link up and we educate ourselves about our health. Okay, thank you very much, Doctor. And also sending greetings to the people that are watching you. Maybe I send greetings to my people, my family, and my colleagues at Kayunga Regional Referral Hospital. Okay. Yes. Okay, thank you very much, Doctor. Now, to our dear viewers, we've seen that Ebola is a serious but knowledgeable and vigilancy and responsible actions. Like with knowledge, we can take down this vaccine. So let's stay informed, avoid misinformation, and also work together as a community to protect our lives and our loved ones. So thank you for tuning in. Stay safe. This has been TV1 New Health Show. Let's meet again next week with more information.